Hi, I'm Patrick. This is Erin. She's a trainer at Memorial, and I'm going to ask her a few questions about sports and sports-related injuries. Erin, would you say that sports injuries have increased in frequency over the years?
Not necessarily the percentage of injuries, the amount of people is increasing, so therefore the injuries are increasing, but as far as the amount of injuries per amount of athletes, it's about the same.
Which injury would you say has increased the most, if any has increased?
Since they're all pretty much around the same, the one that we're becoming more aware of is the concussions. It's just we know so much more, so it seems like there's a lot more in the concussions.
What is some of the concussion protocol that you must go through if you suspect someone has sustained a concussion?
We go through a list of symptoms that are very typical in somebody that has a concussion. In adolescence, you can get symptoms anywhere from 24 to 48 hours after the initial hit. So we kind of have to immediately pull them out of the game or practice, whatever it is that we suspect a concussion, and then we have to give them time. They're not allowed to go back in if a concussion is suspected for at least the 24 hours, and then we kind of just wait to see if any symptoms come on. We also go through a SAC test, which is just a standardized concussion test used all across the nation, and we just ask them a series of questions going over their cognitive abilities and stuff like that. And then if we do think that they have a concussion, we send them into a doctor or physician in the area that's been cleared and certified in concussion. So there's only 3 in this area that you're actually allowed to go see according to our protocol.
Okay, thank you. Do you believe that there is a significant link between concussions and neurodegenerative diseases such as CTE in people who have sustained concussions?
Right now we can't really say. They're still doing research on that to kind of make that link, but there might actually be a link between the subconcussive hits where they don't actually get a concussion but they still get hit, and then multiple of those might be linking to those types of things.
Okay, one final question. What are some prevention techniques an athlete could use in order to reduce the risk of injury?
For most injuries, bracing and just proper technique, especially in football and dealing with the concussions. You don't want to be spearing and putting your head down. You want to be hitting like the shoulders and not leading with your head, and just proper technique and bracing is probably the 2 best things in muscle strengthening.
Okay, perfect.